Hello, everyone, and welcome. I'm Brandy Svensson. I am the CEO and Creative Director and co-founder of Be the Change Group. I would like to thank all of you for joining us for our webinar titled From Cholera to COVID, How CIPHI is Bringing Awareness to the EHO Profession in Canada. I will be your moderator today, and the webinar will be co-presented with CIPHI and Be the Change Group. The presentation will be approximately 45 minutes in length and followed by a 15-minute Q&A session. Before we begin, I have a few housekeeping items to note. First, today's session will be recorded and we will be sharing a link of the recording along with the slides to all attendees once the webinar concludes, should you wish to refer back to it or share it with your colleagues. Second, the session today is for you. We encourage you to ask questions using the Q&A. And please feel free to pop your questions in throughout the webinar. And lastly, we'll take a few interactive polls and encourage you to participate and have a brief survey at the end to help us improve and provide webinars for you in the future. Now I'll pass it over to Carrie to give us a brief introduction to CIPHI and the environmental public health profession.
Thank you, Brandy. Welcome, everyone. My name is Carrie Engel-Carter, and I'm the National President of CIPHI. On behalf of the National Executive Council, we're so excited to share what we've been working on in partnership with Be the Change Group. For those of you who may not be familiar with the Canadian Institute of Public Health Inspectors, or CIPHI, we are the national professional association that represents environmental health professionals across Canada. This includes public health inspectors, environmental health officers, community care licensing officers, infection control personnel, and consultants. CIPHI is involved in the certification, education, and provision of ongoing professional competencies for environmental public health professionals across Canada. CIPHI is led by the team on the National Executive Council, or the NEC. This is our team pictured here from January 2020. Today on the webinar, I will be co-presenting with Natalie, Manitoba Branch President and National Advocacy Committee Chair, Kevin, National President-elect from Saskatchewan, Casey, BC Branch President and incoming President-elect in 2021, and Vanessa, our National Social Media Manager and Nova Scotia PEI Branch President. We are a completely volunteer-based team and are responsible for the day-to-day operation of CIPHI. We are also the main drivers of any of CIPHI's advocacy initiatives. As environmental health professionals, we know and understand the challenges facing our profession. We know that the general public and our employers do not know who environmental health officers and public health inspectors are. We know that they do not understand the breadth of the work that we do. There's limited media coverage of our work, and it often only shows public health threats or dangers or other business that is shut down. Moreover, environmental public health professionals typically work in the background and do not seek recognition for their work. Therefore, our profession remains unknown and undervalued. We have heard repeatedly from our membership that a public campaign for the profession is needed. We want you to know that the NEC has heard you. It's time for change, and that's why we've hired Brandy and her team from Be the Change Group. We hired Be the Change Group to work with us to evaluate the public's understanding of our profession. They are a population health and creative consulting firm based in Vancouver, BC. And since the beginning of this work, we have felt confident that the Be the Change Group really understands our needs. I'll pass this back to Brandy now.
Thank you, Carrie. Thank you so much for the introduction. We have over 5 years experience working with environmental public health professionals in various capacities. We've had the privilege of working on projects related to food safety and inspections, drinking water, and facility licensing. And all these included strong engagement and connection with environmental public health professionals, understanding your challenges. So we were super honored to have the opportunity to partner with CIPHI in this work. We have a great respect for the very important work you all do and feel that advocacy for your profession is long overdue, but also understand the challenges and why it hasn't happened to date. We believe that it is your time to be pushed front stage a bit. And as you know, we know you're not ones to brag, so we're happy to help you do so. So that you can understand what we are working towards, I thought it would be good to just back up and tell you the goals of our partnership with CIPHI. These include that the public clearly understands how public health inspectors and EHOs contribute to the health and safety of Canadians. that employers value the broad knowledge base of environmental public health professionals, that CIPHI's profile is enhanced with increased respect and recognition from your profession overall, and that Canadians recognize CIPHI as a professional organization. I'd like to now introduce Yelena and Stephanie. They are the researchers on this project and done an excellent job of capturing the voices of environmental public health officers and stakeholders across Canada and beyond. They're now going to share the findings from the discovery phase, and we will start with Yelena.
Thanks so much, Brandy. So before we dive into the work we did, I want to take a step back and talk about the history of the EHO profession, from some key dates and its inception to the present, and even more exciting, the future. So a theme that we see in recounting history is that public health professionals have always been the unsung health heroes of our times. And before I dive in, I'd just like to give a huge thank you to CIPHI historian Tim Rourke for providing some of the historical knowledge and the images that you'll be seeing today. Thank you for all the work that you do, Tim, and to preserve the rich history of the profession. And now, without further ado, here's a brief history of how it all started, or at the very least, how it was documented. So in 1842, the report on the sanitary condition of the laboring population of Great Britain by Edwin Chadwick was released. Historians believe this to be the birth of the environmental health and public health fields. It's the first document that of its kind that directly links health outcomes to the environment in which people live. And it documented some pretty deplorable health conditions which had staggering impacts on the life expectancy of workers at the time. Chadwick's recommendation included building a drainage network to remove sewage and waste, and appointing a national board of health, local boards in each district, and district medical health officers in order to accomplish this goal in the UK. So following Chadwick's report in 1844, Thomas Fresh was appointed the first Inspector of Nuisances by United Kingdom Health Committee. The term Inspector of Nuisances was the first known term for the profession of public health inspectors and environmental health officers. This title was later changed to Sanitary Inspector and eventually Public Health Inspector and Environmental Health Officer, which were adopted later in the 20th century. And as you can see, I couldn't find a picture of Thomas Fresh here from 1844, but when I searched his name, this lovely watercolor painting of his house popped up. Okay, so while Chadwick's report was quite controversial and met with resistance at the time, many of his suggestions were eventually adopted in the UK's Public Health Act of 1848. This is a significant piece of legislation. And meanwhile, in the United States, similar studies to Chadwick's were also taking place. The most famous of these was a survey conducted by Lemuel Shattuck, who is pictured here. His report on the Massachusetts Sanitary Commission was published in 1850. In 1854, history was made by John Snow, but not that John Snow. This John Snow did know something. Widely recognized to be the father of modern-day epidemiology and contact tracing, British doctor John Snow successfully traced the source of a cholera outbreak in Soho, London in 1854. Despite resistance to his theory and the source of the outbreak, Dr. Snow worked around the clock to track down information from hospital and public records on when the outbreak began and if victims ended up drinking the water from the Broad Street pump. John Snow suspected that those who lived or worked near the pump were most likely to use it and thus contract cholera. He was able to successfully convince town officials to take down the Broad Street pump handle, making it impossible to draw water and halting the further spread of cholera. Meanwhile, in 1883, still in the UK, the Association of Public Sanitary Inspectors, the organization which later became the United Kingdom's Chartered Institute of Environmental Health, was established. At this point, the profession became more formalized and regulated through a formal regulatory body. Some 50-odd years later, after the United Kingdom's Chartered Institute of Environmental Health was established, Canada and the US began following suit. In 1913, the Sanitary Inspectors Association of Western Canada, led by President Ernest William J. Haag, the chief health inspector for the city of Winnipeg at the time, was established. This was the first organized Canadian association for the profession. In 1934, the Sanitary Inspectors of Western Canada expanded to become the Canadian Institute of Sanitary Inspectors. This was really the precursor to the organization that we know and recognize today, CIPHI. And here's one of the first logos from the 1930s. And while it's not so often that we get to say this, we just want to acknowledge that Canada did it first. It wasn't until 1937 that in the United States, the National Environmental Health Association was established. And in 1942, history was made. June Lawson made history as the first female public health inspector in Canada. In 1960, the delegates at the annual general meeting in Montreal approved a name change for the Institute. And after a great debate and voting on 7 final choices, the name the Canadian Institute of Public Health Inspectors was authorized. So since then, a few inquiries have been made around raising the profile of the profession. Most notably, in 2019, there was concerted efforts in the United States to promote the profession. Uncover EH was a partnership between the CDC, the National Environmental Health Association, NEHA, and the Baylor University to hear directly from environmental health professionals working at health departments around their practice, work, and their challenges. This resulted in 3 significant publications, some of which you'll see showcased here in this picture. However, in these efforts, we did see that PHIs and EHOs are still very much talking only to each other and in the background. And this brings us to now. So in November 2019, CIPHI was seeking a firm to assist in the development and implementation of a health promotion marketing strategy, with the primary goal of developing a stronger and more recognizable profession and public identity for the organization. This was the first time a concerted effort to raise the profile of the profession was made in Canada. And this brings us to 2020. I'm now going to turn it over to my colleague and researcher, Stephanie Liu, who's going to present our findings from the research phase of our work with CIPHI. Thank you.
Thank you, Yelena. In January 2019, our firm was hired by CIPHI to help raise the profile of the profession through an advocacy campaign. As a research and creative firm, we ensure that all our work is evidence-based. As such, we wanted to ensure that we heard from environmental health officers and public health inspectors across Canada and from key stakeholders not only in Canada, but also organizational counterparts in the US and in the UK. We call this our discovery phase, and we are excited to share some of the findings with you today. So this slide summarizes our engagement, which included a total of 773 individuals from across Canada. We heard from 593 individuals with a CPHI-C designation, 143 students, 29 members of the general public through focus groups, 17 key informants, who are individuals that represent and speak for a larger group of individuals. For this project, some of the key informants were medical health officers, environmental public health program managers, and public health inspectors. Overall, we aim to include as many voices as possible so that our findings could reflect the various regions and different challenges across Canada. We'd like to note one important caveat. Our data collection did occur during the COVID-19 pandemic, which did impact our timelines and may have impacted public perception. So the data we gathered was insightful and provides the foundation for all of and any of the campaigns and developments in our next phase of work. Some of the data reinforced our understanding of the profession, while other findings were surprises. And we know that you're as curious about the data as we are, so let's get into it. When we started this project, we heard from the NEC that there was a lack of public understanding about the profession. To explore this, we conducted a survey with CIPHI members, non-member EHOs, and students. So one of the questions we asked was, what are the main reasons for a lack of public understanding about the environmental health, about what environmental health professionals do? So before we look at the results, we thought it would be interesting to see what all of you, our webinar attendees, think was the top answer. So we'll launch your poll and you can use that feature to submit your answer. And we'll give you about 30 seconds to submit your top answer.
Give about 20 more seconds. See, we're halfway there. Okay, great. 10 more seconds. And I'll close it now.
Thank you, Brandy. So we can see from our poll, the top response that was submitted by our attendees was the visibility of the work with 41% of the votes. Lack of public education about the field of environmental public health had 25% of the votes, and wide range of roles within the environmental health profession, making it challenging to define the profession, had 26% of the votes. So let's compare this with the findings from our membership survey. So the top 3 reasons that we heard is limited media representation, visibility of the work, and also lack of public education about the field itself. So we'll leave this up for a few seconds just for you to review. And we also conducted 4 focus groups with the general public, meaning anyone that didn't work as an EHO or directly with EHOs across Canada. And here we heard very similar reasons for a lack of understanding about your profession, such as low public understanding about the term environmental public health, low awareness of who keeps public spaces safe, and also negative pop culture and representation on TV. So for example, we heard references to Larry the Cable Guy becoming a public health inspector, or the restaurant inspector in Ratatouille, who comes into restaurants and closes them down for health violations. Public health inspectors are typically portrayed as storming in and throwing things around and making everyone upset. And while these might be a funny character in media, it's not a great representation of the profession itself. And what surprised us the most is how little the public knew about your profession. Most individuals had no idea who, how, or when things were checked for safety, such as our water sources, air quality, and safety and care facilities. And this quote from a focus group participant is a good summary of this sentiment. Growing up in Canada, I've never had any issue being in public places, like from restaurants, from gyms, or recreation centers, or anything like that. In my mind, it's regulated somehow by someone. To no surprise, participants were familiar with the profession in relation to restaurant inspections, but we felt that this also harmed the perception of your profession, its complexities, and also your level of education. And this quote summarizes this problem well. I don't necessarily feel like they have to have a degree to go into a restaurant and see if the temperatures are right. I think they report their information to someone else, but I don't think they needed a degree just for investigating spaces. Another point of note from focus groups was that even though we were in the height of the first wave of COVID-19, there were still varying levels of general understanding about the term public health. And only a couple of participants could actually define it, and few fully understood it. The term environmental public health was not clearly defined or understood by any of our focus group participants, even the 2 environmental health sciences students that were participants. So we also asked the CIPHI membership, what do you think are the main challenges facing the environmental public health profession? Again, we'd like to pose this to you as a poll. So what do you think are the main challenges? We'll give you, again, 60 seconds to respond.
Okay, I'll give it 20 more seconds. Okay, it seems voting has stopped.
Okay. Thank you, Brandy. So we see that 42% of the votes was for lack of public awareness about the role of EPH. We also see a main challenge was that it's not valued by the general public, the 25% of the votes, and also not valued by government, 13% of the votes. So let's compare this with our findings from the membership survey. So the top 3 responses and reasons we heard was lack of public awareness about the role of EPH professionals, limited and largely negative media representation. So for example, only during environmental health crisis or mishaps, and also not valued by the government. And I'll leave this up for a minute for everyone to review. So we heard early on from the NEC that respect for the profession was one of the challenges that needed to be addressed. And this quote summarizes the challenge. It says, "I don't think we get a lot of respect as a profession. Our leaders don't know what we do, where the gaps exist, they expect us to fill. Then we get cut out of some things where we ought to be involved. Well, that's not an appropriate use, nor is it an effective use of that resource." So now I'll pass it back to Brandy to talk about what we're going to be doing moving forward.
Thank you, Stephanie. So before I jump into the next section, I just want to remind everyone, I see that I've had a couple of questions come in. Some of them we might have answered, but please pop some questions in the chat for CIPHI about the data, anything you want to know in your question box. And before we talk about what you said you wanted to see CIPHI do moving forward, I want to highlight the things that we heard that CIPHI is doing well. These include upholding the professional standards, connecting public health inspectors both provincially and nationally, that CIPHI leaders have been accessible when contacted, CIPHI is well recognized within the profession across Canada, and the good job that they're doing around the promotion during Environmental Public Health Week. There was also a very, very strong direction that came from the CIPHI membership on what CIPHI needs to do moving forward. This formed a clear action plan for us and for CIPHI, for the NEC, and they're committed to ensuring that your voices are in action. The plan includes the following steps: to provide more value with your membership to CIPHI, to collaborate and partner with other environmental health organizations, to broaden CIPHI's appeal to potential members, and to improve advocacy efforts and promote the profession. Please note that these aren't in any particular order. Highlight the role of environmental health officers during the COVID-19 pandemic. Conduct a public health campaign for environmental public health professionals across Canada to improve the website. And one of the key things that we heard is that you guys want national unity on the websites, but still have branch specific content. So we're addressing that with the new website. We also heard that you guys would like to hear your information. When we polled, it was 30% would like to hear it from national, 13% would like to hear it from local, and 40% want to hear it from both. So we really heard that there's an importance for having some individual voices, because of course every province is unique, which we've learned more than ever throughout this pandemic. And then additionally, you guys let us know what website features you like and that you use, and what website features you'd like to see moving forward. So those have been noted and we are working on those. And then explore recruitment strategies for the profession. Now I'm going to hand it over to Natalie. Natalie is on the NEC and she is the National Advocacy Committee Chair, and she's going to discuss some of the advocacy pieces.
Thanks, Brandy. So evidently, the profession clearly needs advocacy, and this needs to happen at all levels, including the top 3 audiences that you have identified as targets: the general public, members of parliament, and politicians and employers. The following quote from a key informant summarizes what you requested. The government will listen to the public more than they would listen to anybody. So when the public says, we need these people are important. They're the ones keeping our water safe, keeping food and air quality safe. It's really advocacy at all levels, internally, at the government level, and of course, the public. You have identified several things that you want us to communicate. Here are some of the key ideas that we want to highlight. We have a vast role and vast responsibilities in public health and beyond restaurant health inspections. We are highly educated, science-based professionals. The different roles of PHIs and EHOs during the COVID-19 response, a more positive association with the term inspector, and lastly, that we are partners in the community. The channels you want us to use to communicate these key ideas include advocacy to government, and this includes face-to-face meetings, sending letters and petitions, social media, and TV and commercial spots. You want advocacy for our profession, and again, this needs to happen at all levels. We heard you. We have started doing this work with both our COVID-19 campaign in the spring, and most recently, the National Environmental Public Health Week campaign. With the help of Be the Change Group, Casey Neathway, Vanessa Nicolo, and the entire NEC, major collaboration occurred to reach out to other organizations and have a greater presence on social media celebrating Environmental Public Health Week. With both the COVID-19 and Environmental Public Health Week campaigns, CIPHI's national social media presence was boosted considerably thanks to Be the Change Group. When the COVID-19 campaign ended in August, Vanessa Nicolo volunteered to be our national social media manager and continued the same format, managing our social media accounts for a continued presence. Vanessa has excelled in overseeing the social media account postings, providing relevant and useful information, and is now our formal social media manager. I'm going to hand it over now to Vanessa to talk a little bit about the successes of both of these campaigns.
Thanks, Natalie. So the COVID-19 campaign was launched in order to highlight the vital work done by EHOs and PHIs. Here is an overview of all the social media posts created for this campaign. These are all individuals working as PHI and EHOs, and they're also CIPHI members. During the pandemic, we saw our public health inspectors working the front lines of the response. Environmental public health professionals were involved in many different roles across Canada, including enforcing public health acts and other regulations, enforcing public health orders such as isolating and physical distancing, conducting consultations and inspections focused on COVID-19 mitigation requirements for public spaces, upholding sanitation and disinfection standards in public spaces across Canada, reviewing COVID-19 response plans within facilities to ensure mitigation measures are in place, and supporting partners in public health to continue to manage the COVID-19 response. The COVID-19 campaign was launched in order to highlight the vital work done by EHOs and PHIs. The Thank You Public Health Inspectors post reached just under 24,000 people, and our video about proper cleaning product use reached almost 5,500 people. A big shout out and thank you to everyone that participated in the campaign. It was made possible because CIPHI members across Canada sent their submissions, including selfies and videos. An extra shout out to Megan from Alberta, whose videos went viral. Our Environmental Public Health Week 2020 campaign was very successful. This year's theme was Public Health is a Collective Effort, and we felt that it was so important to recognize and celebrate our peers and key community partners. We made social media posts across all of our platforms and saw a huge amount of engagement. Just some of the successes include a Facebook post on September 21st that reached just under 32,000 people, which is the most on our Facebook to date. The CIPHI Facebook page has 57 new likes and counting, with an obvious increase in the usual likes during Environmental Public Health Week. We saw a large reach from the Facebook posts, especially at the beginning of the Environmental Public Health Week. And we hit over 20,000 tweet impressions on Twitter. Through this campaign, we gave and received kudos from many of our partner organizations. Here are just a few examples of our partners. Now I'd like to introduce Casey to talk about an exciting new partnership for CIPHI.
Great, thanks, Vanessa. On behalf of the NEC, we're very excited to announce that we're exploring a new partnership between CIPHI and Indigenous Services Canada. Indigenous Services provides direct funding and services and collaborates with partners to improve health access for First Nations, Inuit, and Métis people across Canada. It also employs environmental public health officers and support staff for the delivery of public health and health promotion services, both internally and through partner organizations. ISC is developing a comprehensive strategy to reduce Indigenous people to work in the environmental public health sector with a focus on youth, people in rural communities, and women. This work is closely aligned with our advocacy efforts. Additionally, we're an ideal partner for Indigenous services because we are the only national professional association that represents environmental public health professionals working as public health inspectors and EPHOs in Canada. We are committing to the inclusion of Indigenous communities and perspectives in all of our ongoing advocacy activities and the profession, including recognizing the value and importance of Indigenous ways of knowing and linkages between the health of the people and the health of the land, which Indigenous communities have been stewarding since time immemorial. I'm going to hand it back to our National President, Carrie, now.
Thanks, Casey. I think this quote really shows where our profession accurately captures all the hardworking EHOs and PHIs. We are doers, we're not talkers, and this is much to our own demise. When we do talk, we talk to ourselves. We don't talk to people outside our profession. So we talk at our conferences, but who's there? We talk in our journals, but who's there? We are. We're not talking to people out there. So we work hard and we get the work done and we're making our communities safer, but we're working in the background and that hasn't changed from cholera to COVID, but it all changes now. The NEC has made financial commitments to move forward to the next phase of this work, which will help CIPHI to achieve its goals of raising the profile of the profession. This work also includes the development of a 3-year marketing and advocacy strategy, a new CIPHI website design and build, the development of a marketing campaign and assets, and the launch of this campaign. We are excited to get started with the goal of a new website launching in 2021. The new website will include public-facing content, which will help inform the general public. Now I will pass to Kevin Capel, who will be our president as of January 1st.
Yes, thank you for the introduction, Carrie. As you mentioned, my name is Kevin Capel. I'm the president-elect for the National Executive Council, and will take over as president in 2021, which I am excited to take on that challenge. So one of the goals of the webinar is to encourage you, as our members, to take action and help support CIPHI and the advocacy of our profession. Here are some ways that you can participate. You can follow us on social media, on all our social media platforms, follow and share content, and participate in upcoming social media campaigns. You can also volunteer with CIPHI through our various committees. Currently, we are looking for individuals to join our website committee. If you are interested, please contact Natalie Loudon. We are looking for user testers as well for the new website, and if you're interested, please contact Stephanie at Be The Change. Consider presenting at an upcoming CIPHI webinar, or if you're interested in doing your own webinar, you can do so through your local branch. You can also connect with your local CIPHI branch representative, and their emails are posted here for you. Also, I think most importantly, we need to continue to talk about CIPHI and talk about our profession. When we're out there doing the job, we can do that locally. It's time for our profession to come out of the shadows and really tell people in our community what we're there to do and how we're there to protect the health of all Canadians. And so now we'll move on to the Q&A session, and I'll throw it back over to Brandy.
Thank you, Kevin. So that's the end of our presentation today. And now it's time for us to take questions from you. So please go ahead. It should be in your lower box of your screen. And there is a little thing that has a Q&A. So the very first question I think that we answered, but I want to make sure that we talk a little bit more, and I'll probably throw this over to Yelena. Did the name environmental health factor into misconceptions about the field?
Yeah, absolutely. Let me just start my video here. We absolutely did hear that environmental health officer was sometimes a confusing term, just in terms of understanding what public health inspectors and environmental health officers do. We also heard that it was confusing because there's two names for the same profession. So this confusion was mostly echoed through our focus groups with the general public.
Thank you, Yelena. And we have another comment around appreciating what the NAC is doing during the pandemic, but said that there wasn't as much content of highlighting the work that they wanted to see during Environmental Public Health Week. So your comment has been noted. And those are all the questions we have. So I do encourage people, please feel free. You can ask us questions about the data. Oh, here we go. Kudos from Neha on this initiative. Bravo. What is your definition of success for the 3-year marketing campaign? That's a great question. Thank you so much, David from NEHA. It's nice to have our US counterparts joining us today. Does anyone want to take a stab? I think I might throw to you, Natalie. What would be your definition of success for the 3-year marketing campaign?
Thanks, Brandy. I think my only comment to that would be to reach the target goals that were defined based on the member survey. And essentially, it's just better recognition for the profession, better public understanding of the role of the profession, and understanding that a lot of the work is behind the scenes, but it's very important work and it's preventative work for a lot of it. And yeah, just basically being able to brand the profession a little bit better. Again, because the members are so used to working behind the scenes, they don't spend a lot of time advocating for themselves and the important work they're doing. And therefore, in general, oftentimes colleagues in different areas, different departments don't have an understanding of how these environmental health professionals can work collaboratively and what contributions they're making to the community.
Thank you, Natalie. Did anyone else from the NEC want to add to that? Great. I'll also add as well, David, I think one of the things that we realized in our cross-jurisdictional review, so looking at the US and the UK and Canada, that all the campaigns have been very similar in that they tell the stories of the profession and the stories of individuals, but we haven't seen a very large campaign that just specifically targeted at the public and explaining to them that this is who keeps your water safe, this is how you can, and this is why you can enjoy your communities, your public facilities, drop off your children and feel safe. So I think that's something that we've really wanted to look at as an opportunity to educate the general public. And I think that we heard that. I don't know if you have the same experience in the US, but Canadians have apathy because they just expect it's being taken care of. It's fine. I don't have to worry about it. So really addressing that. So do we have any more questions? Again, you can ask any questions for the NEC for anything, even if it's not related specifically to this presentation, but this opportunity to speak directly with your national executive team, as well as any questions about the data or our methodology. Okay, so I will then conclude. I will move to the next slide. And let Carrie take us out. Thank you everyone for coming today. Carrie, please go ahead.
Thank you everyone for joining us today for our first webinar. We hope you enjoyed this session. Please be sure to watch for any upcoming advocacy campaign and for the new CIPHI website. And we'll share the recording of this this webinar shortly by email. We will also be sharing the webinar on CIPHI social media challenges as well. So thank you very much for your time today.
Thank you. Enjoy the rest of your day.